it really embodies a lot of the values that are important to us. And that's like, just take care of people like you want to be taken care of and how you would want your parents to be taken care of.
Welcome back, ladies and gentlemen, to another fabulous episode of the Healthcare Trailblazers podcast. Very excited to be sitting here today with the fabulous John Kao. John, this is an interview that is a year in the making. Been following John for quite some time. John is the founder and CEO at Alignment Health, one of the top health plans in the country, focusing on Medicare Advantage patients. John has built this just incredible organization. They're doing a ton of incredibly innovative things that I personally find fascinating, including a Black Card membership to incentivize patients. There's a focus on whole patient care. There's so much to get into. John, thank you so much for sitting with us today.
Thanks for having me, Mendel.
So let's do very quickly. Where'd you grow up and why healthcare?
I grew up in Palo Alto, California. I was born in Taiwan.
Okay.
I immigrated here when I was 3, and then I grew up in Palo Alto. And I went to Santa Clara University, and then I went to UCLA Business School.
Okay, and what did you go for? Healthcare?
No, I did all finance, and then I went and worked at a bank, and then I worked on a bunch of healthcare-related transactions, and I said, I'm going to go to a healthcare company and learn about what's really going on in healthcare. So I joined a company called FHP, which was subsequently bought by a company called PacifiCare, which is now part of United. But I really learned about the business, the financing from the health plan perspective, which is really, I would refer to that as the top of the food chain, and just really learned so much about it. And my career just started taken off in healthcare, and just one thing led to another, and we can get into that also. But at the end of the day, healthcare is an area that you can help people in mass. You can actually serve people in mass. Everybody's had or has a parent that is going to be in need of some form of healthcare, and we're going to be needing some form of healthcare, particularly in Medicare. And so that was the field that I chose. It gives me a lot of purpose to doing what I do and waking up every day. Is to help people.
So, a lot of people, they kind of organically moved their way up the food chain in healthcare because they started in healthcare. There's either some formative experience as a child, or they went to medical school, they became a doctor, but they also had a business sense. And, you seem to just have gone, I mean, you correct me if I'm wrong, but yeah, like from your FHP or PacifiCare, whatever that time to Alignment, doesn't seem to be a very long time. My question to you is, you said that healthcare is a place where you can help people, and you're absolutely correct. And looking at Alignment today, you're helping how many patients are on the plan?
About 115,000 seniors right now.
Ridiculous, right? My question to you is, when you started this, I guess, 10 years ago or so?
Right.
Healthcare is such a big opportunity, but it's almost equally, if not more, a big problem. And when you look at it, it seems like an insurmountable problem. What in the world got into you that you actually thought that you can do this?
Yeah, no. So just to finish the story on the background, so at FHP, and so at FHP, this was going back to I'm going to date myself here, 1995, I think, something like that. FHP was one of the first Medicare Advantage contractors, and so it was a vertically integrated staff model. It was kind of Kaiser and then FHP in California. And FHP got bought by PacifiCare. So at FHP, I learned about vertical integration. How do health plans, doctors, hospitals, community to all work together in a vertically integrated environment? Sold to PacifiCare right around 1995, 96. And PacifiCare was all about partnering with doctors doctors and doctor groups, specifically healthcare partners at the time, and they created something called Secure Horizons, which got to like 15, 1.5 million in terms of seniors. So huge.
Whoa.
So after that, I went to a company called, my good friend Jeff Margolis and I were at FHP together, and then I went to Pacificare, and then he went and created something called TriZetto, which is a healthcare IT company that sold and serviced software applications, specifically something called Facets. So I went back and partnered with him, and we grew that company significantly at TriZetto. But there I learned about systems and IT. They're different. Processes, systems, supply chains. And so then when the MMA happened in 2004, I went to a company called CareMore. And so with that regulatory change, there was opportunity. And the former CEO of Pacificare, a good friend of mine, Alan Hoops, and I said, you know what, there's opportunity. Let's go buy CareMore. And so we got private equity and we bought CareMore. And it's just the most amazing journey during that CareMore experience. We were kind of health plan guys that went into a small little plan. I think it had 15,000 lives at the time, but it had this fascinating care model, just this genius care model. And the model was they had care centers to take care of the 10% of the polychronic sick. And they said, that 10 to 20%, if you know who they are, and you just take care of them, and you do your diabetes management, wound care, podiatry care, pre-op care, all this like stuff you do in the care center to extend the care of the primary care. And so it lowered all the trend and gave better care to people. And so a bunch of health plan guys going into this little thing, and the most amazing thing happened. We were transformed. And we loved the provider side. The doctors are God's gift to us all. And I mean that with all sincerity. The doctors and the nurses are angels. And we fell in love with that model. And so what we did was we took our large company scale experience and product experience and insurance experience, and we complemented it with this care delivery model, and they changed us. It was the most amazing journey. And then we ended up selling it, from a great return with these private equity guys, to, at the time, a company called WellPoint, which is now Elevance. And so when I started, just to get to your point, Mendel, is when I started Alignment, it was to finish that journey. Because if you take FHP, it's staff models. Pacificare is partnering with doctors. TriZetto was technology. CareMore was polychronic, bending the cost curve. You take all those different things, and it's like God led me to this place with Alignment, combined with the fact that at the time my mom had a heart attack. So she goes in the hospital. I get the call, whatever it was on a Sunday morning. And she's screaming at me in Chinese, get over here. And so she gets in, she gets 3 stents put in, the cath lab. The care inside the hospital was good, but the care outside the hospital and the discharge planning process was scary. Nobody talked to each other. So if you take my background and you take my very personal experience, I said, if I don't try to do something, who will? If I don't try, who will? And that's how it started. It's a very personal experience. My heart and my motive is to treat every one of our seniors like my mom, and that's everything. It's every time I go over there to see my mom, she's still she's been 9 years
Wow.
since that happened. She's still doing fine. She's 90. She's an alignment member. She loves alignment more than she loves me. I mean, it's unbelievable. But that's how it got started.
Wow.
Just
Wow.
the passion of serving, Mendel, is the key to the whole thing.
Wow. Yeah, there's so much there, and it's there's so many takeaway points, but one of them, just off the surface, is it's so easy for people to get caught up in, as humans, as humans, part of the human condition is it's very difficult for us to see past our current reality, right? To a large extent, we're able to see behind us, but it's almost impossible for us to appreciate what's ahead of us because we can't see it. And so it's so important to hear these stories and to watch you, objectively go through each of those steps on that journey and accumulate that experience, accumulate block 1, block 2, block 3, block 4, and then bust out the gate with alignment, like the cliche of the overnight success with, 30 years under the water, right? But I just, that is such a powerful lesson for people. Like, every step that you are in life, like, appreciate it for what it is and understand that you're collecting bricks, you're stacking bricks, and each of those are important,
Yep.
But
Yep. No.
from a care perspective, and I actually have the same question about alignment. So let's go back to CareMore for a second. So you said CareMore was a plan, right?
It was a plan, but it also was a medical group.
Okay. So how does that work?
So the way was the member would choose CareMore, the plan.
Okay.
They would select, say, a CareMore medical group doctor. And so the CareMore medical doctor would serve and take care of that patient like any other PCP. But CareMore had these, we called them CCCs, so those bricks and mortar chronic care centers. And so whenever any of the patients that came in to CareMore Medical Group or any of our contracted closely aligned doctors were sick, had polychronic conditions, that PCP would call one of our staff doctors, and we would call these doctors extensivists. That's my partner, Don Furman's. He coined that Dr. Don Furman coined that phrase. And it's an extension of the primary care. We're there to serve that doctor. And so anybody that was sick, that was, they needed a lot of care, we were a resource to the doctor. And so that doctor would always basically, have that patient coordinated with our extensivists and our care teams and be seen at the care center for whatever. The simple thing, podiatry. Well, what do you mean podiatry? Well, clipping nails. Seniors are, they can't clip their own nails. So we clip their nails for them. Coumadin care, wound care, just cleaning their wounds. We would do all that on a routine basis. And so the PCPs loved us because we're a free resource to help provide better care.
Right.
And so that's how it worked. And so at Alignment, it was like the next iteration of that. Because the one problem about the CareMore model was you couldn't scale it as much because you had bricks and mortar in each marketplace. And so what we concluded from that experience was if we had data to actually identify proactively who that 10 to 20% of these really sick patients were, this whole notion of identifying them with data and then taking care of them at the home in support of a community doctor, right? So there's no bricks and mortar capital required.
Mm-hmm.
You use data, and then you take care of and you align with that primary care. That's how we've grown the model. That's how we've grown the business. It's the values of the company are just take care of the senior, number one. Forget about it. Just take care of this person like your mom or your dad. Number two, support the doctor. Support that clinician.
And by clinician, you mean the community doctor?
Community doctor.
Okay.
Community doctor. And three, use data and technology to change healthcare. And number four, which I think is the most important, is have a serving heart. Now, those seem kind of simple. Just take care of the senior, support the doctor, use data and technology, have a serving heart. Which one of the health plans out there, big public ones, would have those same values as us? Very specifically, the words are really important. Wellness, healthcare, data, technology, blah, blah, those specific words, not many.
Yeah.
And it's saying that's been the key to our success.
Wow.
Because like in Medicare Advantage, it happens to be good business for just taking care of people. And that's why we love Medicare Advantage so much. It rewards you for having high quality of care at a low cost.
Yep. So, couple questions. How did you get started with? How did you do that without making the community doctor feel threatened by you? How did you do it in a supportive way without them feeling like you were just stealing their patients?
Great question. And I've talked to hundreds, if not thousands of doctors, every single one, like almost like this, okay, when we go and talk to them, they're like this. And typically their spouse, their wife or whatever, or significant other is the office manager sitting there. They're leaning back and they're like this. And we say, you're getting paid fee for service now through Medicare fee schedule. They go, yeah, right. I said, okay, so for 99213, you're getting paid, whatever it is. Let's pick a number, depending on your market, $50 per visit. Is that right? That's right. Okay, and then we say, the national statistics would say, and your market statistics would say, you're seeing that patient about 7 times a year. Okay, so you're getting paid, 50 times. And it could be any number, but just for simplicity, let's do that's $50. Okay, so you're getting paid 50 times 7. That's $350 per year, on average, per patient on a fee-for-service basis. Is that right? They go, yeah, that's about right. We say, okay, I tell you what, we will guarantee you $350 per year. And we'll pay you, whatever it is, $30 per month. I mean, we should jack the numbers up, actually, but just for illustrative purposes. And so what happens is you get a guaranteed monthly payment for that patient, which is your patient. They can see you whenever they want. You can get paid whether they see you or don't get to see you. But we have something that will identify who the 10, this is where our data and technology stack comes into play. We have data that specifically will identify the 20% of your members that are really sick. Let us help you with those members. And so we say, that patient is not a 15-minute office visit. That's an hour office visit, right? It's still your patient. Let us take our staff model, when we call it Care Anywhere, which is we have 260 now, I think, employed clinicians, that all they do is they see patients at the home. So if you're in that eligible 10% of the polychronic population, that cohort, we'll have our interdisciplinary team comprised of doctors, nurses, case managers, social workers, mental health experts, take care of you at the home, depending upon your needs and your acuity. And it's just a bunch of, it's always just being there. It's being attentive to take care of them, to keep them out of the hospital. And so every time one of our nurses, say, sees a patient that is of the patient of the PCP, they get a note, they get a fax, they get an EHR connection, whatever it is, they're always in the loop. And so we become an extension of that PCP, and we say these nurses and doctors on our side are not in the provider directory, so we're not going to steal your member, right? And so it's, everybody's aligned, and the doctor is super smart. The doctor's like going, okay, that's kind of, so remember, he's still like this. Doctor goes, that's kind of a cool care model. And we go, right. And then we say, you get paid, you get guaranteed this money, so you can make as much. And by the way, we're going to, if we have gains, profits on this side by keeping people out of the hospital, we're going to share that with you. And by the way, if you have access to our members, you have good stars. Stars is important. You get extra bonuses. So just everything's around quality.
Yeah.
And so so by this point they're kind of like, really? Because it sounds like a great care model. What's the catch? Well, there's no catch. It's like, it's for that 10%. Let us help you. And that 10% is where 90% of the spend is.
Yep.
Right?
Yep.
So the other 90% of your panel, take care of them. If you want us to help you, we'll do that.
Yeah.
And so the doctor's happy, the patient's super happy, and the 90% of the people that don't need the care anywhere help, they're happy because we're able to bend the cost curve down, which gives us the flexibility to have very competitive benefits in the marketplace. So that's what we call the virtuous cycle. You do the right thing, you take care of the people that need it the most, which are these polychronic seniors. They have nobody advocating for them or helping them, right? It's like, we've all gone through it. I went through it. And we're the ones that want to be there to actually help them.
Yep.
And so if you do that, you lower the costs, you then invest that in the benefits and your provider partners, you grow. And when you grow, you got to make sure you service them and take care of them. And that's kind of this virtuous cycle.
Incredible.
And so we're kind of, that's what we're trying to do.
So let's move to the fourth point in your principles. Have a helping heart, or serving heart, did you say?
Serving heart.
You have about 1,000 employees, right?
I think we have 1,428 employees, 400 consultants that we outsource, and we got about 1,800-ish employees now.
How in the world do you get that kind of culture down to the person all the way at the bottom?
It is the second best question. It's what keeps me up at night. And the answer is in the form of two things. Kind of regimented, required training to understand the clinical model for all employees. In other words, let's say you get hired to be a financial analyst in the finance group. What we ultimately want is that person to go and do a 2-day ride along with some of our Care Anywhere nurses, and to actually experience what it's like in the field to serve somebody, to actually go to a senior's house, to see the living conditions, to see what's in that refrigerator or not in the refrigerator, and to see what these clinical people do. I'm telling you, every time we do that, there's this woman in finance that did it. She comes back, as I see her, she's crying. She's just weeping. I go, what's wrong? She goes, I just went on a Care Anywhere ride along, and I'm just so moved. I love this company. I mean, there's like now purpose to her life. There's like, she can link, like she's crunching these numbers, right? Crunching up, and there's like there's a purpose. Another example of this, we had an IT guy. He comes in and we hire him. He does a ride along. He goes to the doctor's office. Doctor's office had a problem with, it was like a pharmacy issue in one of our apps, one of our AVER apps. And the IT guy goes, oh, I can fix that. He goes there, does a few things, changes a thing, and the doctor in the front office said, oh, wow, that's amazing. That's great. But he comes back, he's crying, and he's like, I go, what's wrong? And he goes, I just did the most simple thing, and just to see the impact I had on that doctor and that practice, that helped probably 100 different seniors get better service and better pharmacy prescription. I mean, so it brings meaning to it. Now, we got to get better at it. We have to be more formalized at it. We have to be more organized So that's one thing. The second
And
thing is,
and I suspect, sorry, not to cut you off, but I suspect, John, that you actually have a harder time with the people that do it daily than the people that are than the financial analyst that goes for a ride along. Because the people
well,
that do it daily get desensitized and they get, you know,
well, yeah, I don't know about that.
no?
No, they're pretty good. I mean, the pain points they have, um, with respect to say technology or EHR, we're changing all that. Like we listen. I mean, that's our key. The second thing, just to finish the thought,
Yep.
is there's something called a Serving Heart Leadership Development Program. It's really cool.
Okay.
It's shout out to my good friends that built that, Ken Jennings, and um, it really embodies a lot of the values, that are important to us, and that's like, just take care of people like you want to be taken care of, and how you would want your parents to be taken care of, and it systematically, um, creates a culture. And so, like, every director we send through this thing, and so now we're getting it down to the manager level. So I think there's some systems that can do it. And then the third thing I would say is
Say more.
culture carriers, people, people that understand what we're about. And so if we open a new market, what we do is we have them go to that new market. They camp in that market for a month or so to make sure that people understand how we do things, why we do things, and just train, just train and carry that forward. Um, but that is the thing that keeps me up, is like, how do we retain that? Because even with some of the people that we've hired, even at senior level, it's like it's like it's a different culture from a lot of the corporate stuff that they've been used to.
Yeah. Well, so first off the bat, I mean, a couple things that I can tell right away. Your ability to delegate. You've called out a bunch of people, different teams that are doing things. The way you've built this organization, I think, is incredible. But here's something that keeps me up at night, genuinely. And I've talked about this many times on the podcast. And it seems to me you are the only person that I've seen kind of really take a knack at this. And so I'm really curious about it. My concern with healthcare is that the incentives are extremely perverse, even in specifically in the model that you practice, or in a value-based care model for, the provider or you are incentivized for the patient to change their health habits. And that's really weird because if you think about it, at least in a full value-based care role, right? If you could bring those costs down and manage the patient better, then you save money, right? And so in a way, you're incentivized. So to me, it's kind of like if I were to sit down with a financial advisor, and the dynamic of that conversation was the financial advisor was begging me to sit down with them for 20 minutes a month to talk about my finances, right? I'd say, well, thank you so much. Maybe I'll sit down, maybe I won't, but then I'd continue racking up debt on my credit card because it went in one ear, one and out the other. And I think that, and so I always question, like, how can we get the actual patients in the conversation in an equally, if not more, emotionally equitable manner than the care provider? And I noticed something about alignment, and this was actually the impetus for me reaching out, about a year ago, which was this black card, this black card thing that you have going on. You have some sort of incentive structure that seems really interesting. I know it's probably not your direct project, but even just as a general concept, if you have any thoughts on how to pull the patient in and incentivize the patient to be in that conversation.
Yeah, totally. It's I give all that credit to my partner Don Maroney, um, and the concept is very simple. It's like, any other kind of, black card, i.e., you're a special person, and so associated with that being special is there are certain benefits that you can treat that card as essentially a debit card, and so we preload that card, and you can go and buy over-the-counter drugs, and you can buy groceries, and you can apply it for certain specialty care, dental care, for example. And it's intended to give the senior a sense of feeling special, and that the benefits that they get for being part of our benefit design is designed to give them the most concierge-like experience. And so all of a sudden, you then design the components of that black card, and you say, okay, as part of your raw benefits, you get, whatever, X dollars, $100 in groceries or whatever it is, depending on a product. But also we'll add a, healthy rewards benefit to that. Meaning if you see your doctor and you get, breast screening or, whatever it is that for that individual we want them to do to take care of their health, you get extra credits for that. I mean, it's creating engagement and it's creating alignment. But I would say our Care Anywhere program dovetails perfectly into that. And it goes back to my original concept around advocacy. Just like somebody to care,
Yeah.
and so like one of the nurses went over to my mom, and it's like this nurse is like family to my mom. I mean, she's like literally family. But we had this black card. It's linked up to Walmart, and the nurse helped my mom with the computer. She ordered a bunch of stuff, OTC stuff on Walmart, went through, it was perfect, no problem. I mean, it's just somebody to help, right? Because if like in my life, if somebody else doesn't do it, I have to do it.
Yeah.
I'm not I'm not equipped to do it. And so now the whole idea is to serve all of these people that need help, and also to provide just some consistent companionship, somebody to show up and talk to.
Yeah. Loneliness is such an
It's it's a
epidemic.
huge epidemic, right? And so they look forward to it, and the mental health aspect of this is so important,
Incredible.
you know. Yeah.
John, your passion for what you do really genuinely comes through everything that you say, and it's very cool for me to sit here and talk to all these various leaders, and it's actually very heartening to see people like yourself that are at the helm of companies that are really actually making an impact. And that's why I said at the beginning of this, like, you standing there 10 years ago, and obviously the context definitely helps, but you standing there 10 years ago looking at this insurmountable issue called healthcare in America, and now you're 10, 11 years later looking back, and you've got 150,000 members on, and almost 2,000 employees, and you're making a real dent. I think it's amazing. Final question for you. I could sit here for 3 hours with you, but looking back, when you decide that your career is done, what will you have wanted to accomplish with everything?
I'm committed to changing healthcare for seniors, and believe me, I know how how kind of crazy that sounds. I get it. Um, but I think there's an actual algorithm, a formula to make that work. And it's like if you can identify who really needs the help and then give them the care model to take care of them, and then also give them the protection of the actual funding mechanism, which is the insurance, um, and you have the most efficient delivery of care model with the richest benefit, i.e., your virtuous cycle. Take care of the people that need it the most, have benefits, grow, keep them, make them happy, and then you just keep growing. And then from a company point of view, we're at this inflection point where like you said, we're going to be a couple $1 billion. I mean, we're close to that billion. I mean, like this is like when it was like an idea, and it's just scratching the surface of now being in a position to create more alignment, not only with doctors, but with hospitals and health systems. And so the whole name of alignment is, if you create alignment with health systems, the integrated delivery networks, the big hospital systems, the doctors, independent doctors, and or the clinically integrated networks that are part of these health systems, and then we create alignment on the insurance side, you actually create an aligned, to your point, an aligned way of doing care. And by the way, it just happens to be the right thing to do to take care of those individuals that need the care the most.
Yeah.
And, you know, a lot of these hospital systems, Mendel, are like, their brand is so strong, they have capacity problems. You can't get in,
Yeah.
both on the acute side or their doctors.
Yep.
And so with the aging of America, I'm going to cut this, I'll get it done in 1 minute. Aging of America, like the admissions of seniors in these hospitals keeps going up. And so the reality is hospitals get paid more from commercial members. That's just right. This is what you want to do is you want to fill those beds with commercial members, and you want to partner with a company like ours to take care of the seniors
Right.
on the insurance side.
Right.
And so you do, and do the math of it is a hospital wins, their doctors win, there's improved compensation to the doctors, so they don't have to be threatened by selling to somebody. And then we can drive market share to this delivery system. And that's the name alignment. Everybody wins for the benefit of the senior.
Incredible.
So-
John, I have to say I sit with a lot of people on camera, off camera, and it's quite rare to come across a CEO and founder that actually so self-personifies the actual name of the company. I think that everything that you talk about, like, you are fully in alignment with your mission, and that really it really comes through. So I appreciate sitting with you, and thanks again for the time today.
I love the time. I love talking to you, and we're going to get 3 more hours. I just
do
love
it.
talking to you.
Next time in person.
You got it.